in the studio, and she's a beautiful lady, by the way. Something happened when I went out the studio after the conversation we had before the 2 o'clock news, and I'm beginning to suspect her. But we'll talk about that later. It's not something for your ears, but should I tell them? Imagine
Even I'm curious to know.
I live in suspense. That is it. Dr. Ruth Lawrence is in the studio. Good afternoon to you, Dr. Ruth.
Hello, Dennis. Nice to be here.
All right. She's a public health physician, by the way. And as you can tell from her voice and, the way I've addressed her, she's a woman like myself. That is it. And today we're going to talk about something that concerns women, and it is cervical cancer. Now, for some of you, you may be hearing about it for the first time. For some others, you've heard about it before. But you see, this conversation, as much as it is centered around women, it doesn't mean that the men cannot listen to it as well, because the information you will get will be beneficial to the entire family. I'm saying this because sometimes some things that women encounter outside are discovered by the men in their lives. Yeah. True. So for some people who have even gone for diagnosis for breast cancer, the men in their lives had noticed at some point that they had a lump. So if you have a sister, you have a wife, you have a significant other, a fiance, you have a daughter, this conversation concerns everybody. So why don't we dive right into it? So the focus is cervical cancer, but towards the end we'll look at prevention and control, how you can identify that this is indeed cervical cancer, what the statistics are like world over when it comes to cervical cancer. So without further ado, shall we now join the conversation on X? Our X handle is at Nigeria Info PH. Join the conversation on Facebook. Facebook page is Nigeria Info 92.3 PH. You can watch us live and be a part of the conversation by dropping your comments in the comment section. Now, much later, I will be calling out the phone line. So I think I should do that now, so you have it saved up. And when it's time, I'll open the phone line so you can call and have ask your questions and make contributions as well. So, the numbers are 070-0923-0923, 070-0923-0923. You can also call 0817-923-0002 and 0817-923-0003. For your messages, send to the WhatsApp and Telegram number. It is 0809-030-6416. So, cervical cancer it is.
Nigeria Info.
All right, so Dr. Ruth, what is cervical cancer?
Oh, thank you so much. I just want to use this opportunity to actually agree with you on one of the things you said earlier. This is a conversation that does not only include women or involve them, as a matter of fact. It involves men, it involves all stakeholders, even children, as you get to know, but of course, most of it, the decisions that children will make with regards to their health will be made by their parents. So if we can have a lot of women and men on this conversation, please let's go ahead and invite whoever you feel would benefit from this and is available to listen. Yeah. So it's actually a topical matter, cervical cancer. Cancers in general, in the medical field, you find out that cancers are things that before now we would think, they're so far away from us. We had more statistics of cancers outside of this part of the world, more in developed countries and all. But of course, as our methods have improved in terms of data keeping, statistics in general, you find out that we have it closer to us than we ever thought. So cancers in general are just diseases that have to do with abnormal increase in the size or number of cells in the body. So for instance, every aspect of your body is made up of cells, all right, and the way it is naturally, those cells are opposed, okay, in their natural patterns, so that it comes out as the eye, or it comes out as the skin, or as any other part of your body. But unfortunately, if at any point in time one of those cells now has an aberration, and then abnormally starts to increase in number or in size in any part of the body, that's a cancer. Okay, so for cervical cancer, that is a cancer that is taking place in the cervix. The cervix is the mouth of the womb, okay, the womb of a woman. So the mouth is simply the opening through which a baby will come out. So when cells around there start to act abnormally and increase in size and number, you call that cervical cancer. So that's just like a broad overview of what cervical cancer is all about. Yeah.
Okay, so you had talked about statistics world over. Well, what is it like for cervical cancer rate?
Oh yeah, so for cervical cancer, in fact, it's a disease. It's one of the things we call a disease of public health importance, and I'll still come to the why. All right, but one of the important reasons for that is because among women, okay, remember I said it's a cancer that has to do with the cervix, the opening of their womb. So among women, it's second only to breast cancer in terms of affectation. Yes.
Wow.
Yeah, worldwide, the statistics for cancer, breast cancer happens to be the most prevalent cancer among women, and then cervical cancer is second only to it. All right, but if we're talking about cancers generally, cervical cancer actually ranks the fourth in women. Yeah, there's some others, lung cancer, colorectal, there are other parts of the body, that could be affected. But when it comes to the one that borders on women, okay, women, female parts and all, so we're saying breast cancer is the highest in prevalence or affectation, for simple language, and then cervical cancer follows closely behind. So that is a worldwide statistic. Of course, Nigerian women are also involved in that statistic.
All right, like I said, you can watch the conversation live on Facebook. Facebook page is Nigeria Info 92.3 PH, and also on X, which is Twitter, at Nigeria Info PH. Now, if I may ask, what causes cervical cancer?
I know that is an inevitable question.
Of course, because this is our body, all right? I mean, when they say someone has malaria,
true,
you say, okay, the person was bit by the
mosquito.
The mosquito that has the, what they call it, the what mosquito.
What now, female anopheles mosquito?
Not female, I don't care, okay? But this is why you have malaria.
Yeah.
When someone has a headache, you can say, okay, the person was stressed, or the person did not eat well, or the person is not drinking a lot of water.
They're dehydrated
and all. So when someone has diabetes, you can say, this person used to eat diabetes, a lot of sugar, all that. That's why you're getting diabetes.
Some of those things are myths, though.
But I always find an explanation
for it.
And let's be honest. You know why I'm asking about the causes? We live in a climate where sometimes almost everything that happens to someone health-wise is ascribed to one spiritual force or the other.
You're very correct.
And they say, it's village people.
Yes.
This one is, we have angered the gods.
I'm telling you.
Who did you offend?
Or who is calling your name somewhere?
Or who is calling your name somewhere in the village? Because to our understanding, these things were never in existence before now. But now everybody is carrying bad belly for somebody. And they say they are doing that. And that's how you have it. So what exactly causes it?
They'll say they sent it for you.
They sent it for you.
Yeah, you're very correct. It's important to actually dispel some of these myths when it comes to diseases and all. But since we're talking about cervical cancer, truth is that when it comes to cancer, generally rather, we're careful to say this causes cancer. Any particular thing or factor causes cancer, because when you say cause in the scientific world, it means that you're directly linking that to this. Which means when this occurs, this must occur. Yeah, and that's not always the case when it comes to cancer. Rather, we deal more with things we call risk factors.
Oh, okay.
Which means that if this is present, then you have a high chance of coming down with a cancer, in this case cervical cancer. If this is present, that doesn't mean that you will ultimately come down with it, but then you should probably check yourself or be on guard. Okay, be more alert than somebody who probably doesn't have these risk factors. In fact, that's not to say that someone who doesn't have the risk factors cannot come down with So that is actually the irony of cancers. And in the case of cervical cancer, there are things we call non-modifiable risk factors, right? Non-modifiable means you cannot change it. It is what it is. It exists. So you just have to deal with it. Okay, so the first and foremost is being female. You and me.
You have to be female. So even be at risk of having it.
In fact, I need to qualify that female. You have to be biologically female, if you get what I mean.
I get what you mean.
Yeah, you have to be biologically female, which means you have to have a womb. You have to have been born with a womb, okay? Because it's a cancer that has predilection for the cervix, which is the mouth of the womb. So if there's no womb present, then it's not likely you're going to come down with this cancer. So being a woman, having a family history of cervical cancer is a very strong risk factor. Yeah, that's to say, and most especially the first degree relative. That's to say, if you have a mother that was diagnosed with cervical cancer or a sister that was diagnosed with cervical cancer. There's also a link to second degree relatives like aunties and grandmothers, but it's stronger when it's a first degree relative.
Okay, permit me to interject at this point.
Yes, please.
From personal experience, I would say that to a large extent, sometimes when our relatives pass on, we do not take care to find out the cause of death. So when you say having a relative with it, is the same thing for breast cancer sometimes. I remember a particular popular actress, Angelina Jolie, who had to go and remove everything
mastectomy,
because she already knew before time that people in her family had breast cancer. So she was at risk of having it.
True.
But it's not quite the same here. You lose your mother and my mother don't die. Waiting kill her. She died after a brief illness or something. Sometimes people are quite secretive. For me now, I lost my grandmother sometime last year. Or was it the year before last year? I think it was last year.
Sorry for your loss.
Thank you so much. To be honest, till date, I don't know what killed her.
Wow.
I just knew she died.
Okay.
Do I want to know what killed her? Maybe now that you've said it, I want to go and ask.
You should go and know.
Let it be really killed. But then again, that's how many years ago? How many people have that information with them till now? How many people were even issued a death certificate stating exactly what killed them?
Yes.
So it may be quite difficult to identify this. I'm sorry I had to mention this at this point.
No, it's a significant mention. You know, you need to know before I say you need to know if you're at risk. If you have a first degree relative, then you're at risk, which means you need to know if there's a first degree.
So
relative
if anybody dies now, there is a lady, go and find out what's in kill them.
Yeah, well, of course, I mean, because of our to be respectful of people, you know, there's a degree to which you want to pry. So that's why I say first degree relative. Your first degree relative is your sister or your mother. It's not likely you will not know what killed your sister. But I mean, I like to think that it's not likely. Even in the case of your grandmother, we're going a bit further, but you probably would know. But in case of your mother, you probably would know what killed her. Yeah. And as to issuing a death certificate and all, so if there were no proper means of diagnosis when the person was sick and proper means of ascertaining the person was dead, then you may not expect a death certificate. You know, these are the little problems with our system. So if you didn't take the person to the hospital and the person was not issued dead in a hospital, talking about a standard hospital, that's where a death certificate would be issued, and then you would know. It will be, in fact, it will be documented because we don't play with documentation in the world of medicine. All right, so it's easy to know in terms of if on a need to know basis, first degree relative, it's easy to know. It's about asking or just getting informed. Yeah, all right.
No,
yeah.
I know some of us just believe the good Lord gives and the good luck takes, and we leave it at that.
You know, where we usually hear that a person died after a brief illness, maybe on the obituaries and all. Of course, obituaries go public, so you will not necessarily be writing the details of the death. But I'm very sure in most cases, the immediate family, they get to know exactly how it happened. Yeah.
Okay.
Yeah. So that's about the modifiable risk factors. Okay. The non-modifiable risk factors, which are so that's about the non-modifiable.
Modifiable.
Yeah. So for the modifiable, those are things that are well within your control. Okay. To a large extent, you can change them, you can modify them to suit a better, healthy lifestyle. So the first on top of my list is the general outlook of health. Okay, your general nutrition, exercise. It's as basic as that, but it goes a lot. It's even your health consciousness that will drive you to go and find out what killed somebody, right? What killed your relative, what killed your mom, to know, okay, am I at risk, or should I test? When should I test? What are the relevant sources of information? So that's on the basic, a good health seeking behavior and a good health promoting behavior, exercise, rest, good diet and all. So those are all preliminaries. Now, another modifiable risk factor, okay, is what we call HPV infection. Okay, so that's human papillomavirus infection. That's one infection that is of strong public health importance because it's one of the viral infections that have actually been linked directly to cancer. So what that means is that people come down with HPV infection, all right? And then when you come down with that infection, there's a really high chance, okay, of coming down with cervical cancer in the long run if it's not properly diagnosed and treated when due. So it's modifiable because it's an infection that is mostly contracted through sexual behaviors, okay, through sexual intercourse. It's passed down from a man to a woman and vice versa, from a woman to a man. That's why this conversation is also relevant to men. Okay, men don't have uteruses and cervixes, but they also are involved in the chain of transmission. Okay, so if you can modify your sexual behavior, maybe be a little bit more protective, using barrier protection, that's condom, okay, or even sticking to being faithful to your partner who is faithful to you. That's important. All right. So all of that's a modifiable behavior that can actually help the spread of cervical cancer. Another important one is age at sexual debut. So an earlier age, okay, for a sexual debut is the age at when you first have sexual intercourse. So the earlier that age is, okay, the more a girl is being exposed to sexual intercourse. So the more partners she would have. That leads me to my next point, which is multiple sexual partners. These are all modifiable risk factors. So the earlier a girl has had sexual intercourse, the more likely that she'll have multiple sexual partners before a particular age. All right. So all of these put together, all right, are things that would put you at a high risk, okay, to come down with cervical cancer. Mind you, I'm not saying that if you have all these things, for instance, if you have the HPV infection ongoing, if you are a girl who had a sexual debut at 18 or 13 and all that, I'm not saying that ultimately means you will come down with cervical cancer. I'm just saying that this is a high risk group. This is probably the group that should be listening on for when we start to talk about the prevention and the control.
So, risk factors you have mentioned, the non-modifiable being that you must first be biologically female. Meaning you have a uterus, you can reproduce, all right? And then the second one is something about your
first degree family history.
First degree family history. And then, of course, the modifiable, your health lifestyle. I think you also mentioned something about having the HPV infection.
Yes.
Your debut to your sexual, and then of course the multiple sexual partners. Okay. Interesting. So now let me ask this. Yeah, I know some people practice this. A woman gets to an age and she feels like she's done with reproduction, and she takes away her womb.
Okay.
She takes away her uterus. She has no need for it anymore. So there's no need for it to be.
I think I know where you're going.
So if that happens, is the person still at risk? Because I mean, you have to have a cervix to have a cervical cancer. Yeah. So how about that?
Well, okay, so the easy answer to say would be she's not at risk because she doesn't have a womb. That would be the simple answer. But in truth, in medicine, we don't like to give ultimates. Like, it's a no or it's a yes.
Okay.
All right. After all, she was born female. She had a womb. Okay. There are many factors involved. I may not necessarily go into the details, but is it a possibility? Perhaps. Is it slim? If you ask me personally, it's probably slim because the uterus is out and the cervix goes with the uterus. But maybe I need to do a little bit more research on that. But I haven't heard of anybody who removed their womb and came down.
I've heard
cervical cancer.
Some people removed. I don't know if
maybe it was ongoing already, So here's the thing, and the same for breast cancer and all of that. So if the cancer is ongoing already and has spread, okay, in medicine, what we call metastasis, it has involved other organs of the body. Whether you go in or not and remove the organ, whether it be the breast for breast cancer or the womb for cervical cancer, you can't really stop the spread. Okay. Yeah, to a large extent, you may not, let me not say can't, you may not stop the spread. The interventions may not even be sufficient to stop the spread. So we try to avoid that. That's part of the reason we're here, to push the prevention aspect. So you don't want to come down with the cancer because there's a lot going on around there.
Okay. So usually, let's start with what is applicable generally. Some people are not that conscious about their health. It has to take something to make them go to the hospital to get diagnosed, and then the discovery that this is what actually does exist. So that's why I would like us to go to the symptoms before we go to how it's diagnosed, and then how it can be prevented and controlled, and then treatment. So what are the symptoms of cervical cancer?
Yeah, so symptoms. Yeah, there are symptoms. I would say that people should not look out for the symptoms. This is what I mean. We would rather propagate prevention because if you start to see the symptoms, it means something is probably already ongoing. Yeah, and like I said, the world of cervical cancer, managing cervical cancer, it's a lot. The economic impact, the social impact, psychological, physical impact on the person. It's a lot, all right? But that doesn't mean I cannot intimate you on the symptoms, all right? So, for instance, if somebody has come down with full-blown cervical cancer, you could have things like abnormal menstrual bleeding. Every woman has her own regular cycle. So you could have things like bleeding in between, unexplained. You don't know where it's coming from. You're not pregnant. It's not spotting, and then you're just bleeding. Okay. And you could have things like abnormal vaginal discharge. And in this case, it's not the normal female vaginal discharge. Yes. Okay. It will be more copious. It will be a lot. Okay. It will be very foul smelling. And in fact, a woman would hardly pass by without you actually noticing that there's something going on there. All right. She could also have pain on intercourse. So, for instance, where it wasn't there before, and then you get to meet your partner sexually, and then you start having excruciating pain. That is also a very high red flag. Okay. Then there's also the aspect of what we call contact bleeding. So, when it's quiet, when there's no contact there, you don't bleed. But once maybe there's sexual contact, that's usually the contact that will go there. So once there's sexual contact, then you start to see bleeding. So something like maybe immediately after having sex, you start to bleed. All right. Yeah. Or immediately after a doctor does an examination for you, you start to bleed. So contact bleeding. Yeah. So these are all red flags, and especially if they're all put together like this, you have all the symptoms flurried like this. Already there's a very high suspicion of cervical cancer. And at this point, we're trying to diagnose. So it's always best not to even get to this point. Okay, and that's actually the advocacy of this month. Mind you, this is January. This is the month for cervical cancer awareness. Yeah. So the awareness is not even to push the signs and symptoms. Signs and symptoms are left for us doctors. And by the time we start putting those symptoms together and the signs together, we're telling you it is cervical cancer. already you have gone past, the prevention. Yeah. So those are the signs that you look out for. But it's a doctor that will make that diagnosis.
Diagnosis. Okay, so I think from the signs and symptoms, you've already told how it can be diagnosed. So is there any other special way that it can be diagnosed?
Yeah, so that's for diagnosing cervical cancer.
Yeah.
So like I said, this is the month for cervical cancer awareness. And in the public health space, what we are concerned with pushing more often than not is prevention. Okay, we believe strongly in preventing. So don't come down with it. Okay, even when you come down with it, we are advocates for early detection, early diagnosis, because the truth is the earlier you diagnose it, the better your chances of survival. All right, but before you even come down with a florid case of cervical cancer, there are certain things that you can put in place to prevent cervical cancer. And one very strong strategy, okay, in terms of prevention of cervical cancer is the HPV vaccination. All right.
HPV
yes. Vaccination in itself has been a really, really strong strategy in terms of controlling diseases, both communicable and non-communicable in the health space. You talked about your daughter at the beginning of this. I'm very sure at her age, she probably has received a good number of vaccinations.
Vaccines,
Yeah. So she's received them, and all those things to boost your basic immunity. Some of those vaccines, I think most of them are targeted at specific diseases. So you take a vaccine targeted at maybe TB, you take another one targeted at tetanus. You must have even taken tetanus when you were pregnant.
Yeah, I did.
Yeah.
I did.
So most of them are targeted at diseases. So just like you have vaccines targeted at communicable disease, that is diseases that can be transmitted from one person to another, you also have this vaccine we call HPV that has been developed, HPV vaccine that has been developed to target HPV infection. All right. Is supposed to prevent HPV infection, or in a case where you come down with HPV infection, it's supposed to make it a very mild occurrence, something that your body can fight. And all of this ultimately so that your body does not progress to cervical cancer. And HPV vaccination, usually we like to target girls who have not been sexually exposed. Remember I said once you're sexually exposed, once you have a sexual debut, that in itself is a risk factor for cervical cancer. What that means is that strains of cervical cancer, there are more than 150 strains of HPV rather, not cervical cancer.
Wow.
Yeah, it's a virus, human papilloma virus. So there are many strains of it. So with every sexual intercourse, it's possible that a strain has been transmitted. But that may not be the strain that the vaccine is covering. It may or it may not be. But for a girl who has not even had any sexual intercourse, all right, so she is the best to receive this vaccine because her body can now mount an immune response against the HPV infection. That is not to say that maybe a young girl who maybe has been exposed, a younger girl who has been exposed cannot take this vaccine. She may be able to take it, but like I said, I talked about the strains, right? So it's just for you to know that if at all there's been an exposure, but she's still quite young, maybe still a teenager, and she takes it, all right, we're expecting her to be protected, but she might already have been exposed to the strain that vaccine will protect. So it's like a 50-50 thing. 50-50. But we will ultimately say, no, don't take. So even for mature ladies who maybe have not had any sexual exposure or even may have had a sexual exposure, all right, up until about 26 years of age, up until about 26, if you wish to take the HPV vaccine, if you have not been exposed, you're free to do so. If you have been exposed, you are still, nobody will stop you, but it's just for you to know that if you have been exposed, it's a 50-50 protection. And then right after the age of about 26, just to put a pin on it for public health purposes, program purposes and all of that, after the age of 26, we expect that most girls to 26 years of age will probably have had a sexual exposure. I mean, at least once. So we just pin it at that age, not because there's anything particular about 26 years of age, but we just expected that you probably would have had an exposure. So after that age of 26 and upwards, or for any matured female who truly now has has had the sexual exposure, you may not tilt towards vaccination. So you tilt toward what we call screening.
Screening.
Yes.
Okay.
So
because you know what, I think you've paid particular attention to this. For the sexual experience, I mean, we cannot but factor in to the conversation rape victims or rape survivors as we have it. I know usually sometimes when someone goes to the hospital and it is reported this person had been raped, I know there's some things the hospital will do as some sort of first aid examination.
They're rape kits. Yes.
Yeah. All right, so you can go on.
Yeah, so I was talking about screening. This is for more matured female adults, okay, or adult females. All right. So you want to screen because you have already it's established you have had sexual exposure. So screening, it's a health facility. So because it involves actually going right down there and viewing the cervix. So we will have to open up and view the cervix and see if 1 or 2 changes are already taking place. There's actually a protocol for it, and it's like I said. So it's not just a regular thing you see by the roadside. So when you do that, and they're able to detect some degree of change, there are actually some interventions that can be done for you right there on the bed, okay? So we do that, and then it's able to halt any sort of changes that are taking place, okay? Of course, granted, there are people who, at their first screening, you can see that perhaps it has advanced beyond correcting it on the bed right there, which means it probably has advanced to the cancer stage. Okay, so that's why we advocate screening at the earliest possible time, so that in case there are any early changes, you can attack it right head on and make sure that it's halted. And this screening is something that is not just a one-off. So by the time you do it now, and perhaps you're certified free or clear of HPV, it's something that you want to repeat about 2-3 years from then, and then every other 2-3 years, following. So just so that you are sure that you're free of the HPV infection or any preliminary signs of cervical cancer. So these 2 strategies are really strong strategies that that have been put in place in the medical world, in public health space, to actually tackle cervical cancer prevention.
Okay, I was expecting you to mention something about pap smear.
Beautiful. So pap smear will mean that you are trying to specialize the screening. Screening is a broad term. It's just a simplified term for people to know that it involves you going down there and viewing. So there are different levels to the screening. There's a fundamental, basic one. Then pap smear is like a graduate level screening. But I think you should leave that to the doctors, to decipher when and which one is necessary. But they're all under the same umbrella of screening. So essentially, you screen a woman. So you could be doing a visual inspection with acetic acid. That's one of them. You see why I didn't want to go there? Yeah, it's called a VIA. You could want to do that basic one. After doing a VIA, if you're not satisfied with what you're seeing, then you could ask for a pap smear, but they're both under screening. Yes. Too much information, eh?
No, not too much information. I think I'm cringing from experience.
The procedure.
Yes. I've actually had one. I can recall. Yeah. Anyway, wow, that's a lot said already. I think I see some messages on WhatsApp. So at this juncture, I would like to open the phone lines, and then we'll take some calls and take some messages as well. So we've talked screening. So after screening, what next?
So
070-0923-0923 070-0923-0923. WhatsApp and Telegram number is 0809-030-6416. Join the conversation on X at Nigeria Info PH. Facebook page remains Nigeria Info 92.3 PH. You can also call 0817-923-0009. So yes, after screening, what next?
Yeah, so screening, like I said, is already a medical procedure. Okay, so you most likely be doing that in a medical facility, or at the very least under medical supervision, because these days we have outreaches, okay, where they invite medical specialists to undertake it. So after screening, the outcome of screening would determine what next. So there are different things you could see. So you could see a clear cervix. When you see a clear cervix, then you declare the woman free of HPV infection or any changes, and then advise her to maybe repeat it after 2-3 years. Okay. If there are changes, okay, to a degree, so there's a way we grade these changes, grade 1, grade 2, and all of that. So if you see any changes, okay, up to certain grades, then there are some interventions that can be done. Cryotherapy, thermal ablation, they're all medical procedures, yes. So if you did it in a medical facility, they'll probably just refer you to where you can get that cryotherapy done or thermal ablation done, which probably will be on the same bed. But if you did it in like an outreach and all, the outreach will probably refer you to a hospital to go get that done if they didn't bring such services there that day. Yeah. Meanwhile, if the screening revealed something advanced, okay, something beyond maybe stage 1, stage 2 and all, something that looks advanced, they would probably refer you to specialists that handle cervical cancer, which will most likely be the oncologists, the gynecologists that handle cancers. Yeah, so just depending on the outcome of screening. Yeah.
Okay, so let me sound like a typical Nigerian. Dr. You have spoken so well. In short, everything you have said. Pepe. Was there inside? Pepe not inside. However,
okay,
to be very, very realistic, what is the cost implication of this prevention? You talked about the vaccines. Are the vaccines free?
Okay.
You talked about the screening. Is the screening free?
Is it free?
Outreach, outreach. Somebody will say, I'm from so foundation. I want to sponsor these course. The cost implication will be on the person carrying out the outreach. Now, the individuals, because sometimes you may want to take into consideration the fact that the reason why some people are not as particular about their health as they would want to be is because of finance. So people have gone to the land of the great beyond for things that could perhaps be prevented and treated if only they had the finance to take care. So what's the cost implication of the vaccine and of course the screening? I mean, treatment will be dependent on whatever they find after the screening.
Denise, I'm not a salesperson.
I'm just saying, you can see, let me tell you, if I don't ask, somebody is going to call and ask the question. I mean, you could just give a rough whatever, an estimate or something.
Okay. So it's the same way. I mean, I can't put tag on a price for anything individual as an individual, because there are different facilities that would have their different prices. Just the same way, I know if I say PCV, you know what I'm talking about because you have a child. So I cannot tell you the price of PCV because it may vary in different hospitals and all that. Okay, the same way I can't tell you how much is a full blood count or any test whatsoever. Okay, but what I can say about this, firstly, I would say that let me tell you the truth. No matter what price, okay, I put on the vaccine or on the screening or anything that is preliminary or preventive, it's definitely not compared to the price of cure or treatment. If you don't go back with that, with anything, please go back with that mentality. And you talked about people going to the far beyond, maybe because they couldn't access health for financial reasons and all of that. I think it's a matter of priority. And remember when I talked to you about the modifiable risk factors, I deliberately started from our health-seeking behavior. If you have not prioritized your health, if you have not come to the point where health in itself is one of your basics, okay, one of the things that are important to you, you will not set out any part of your income for it on a routine basis. And at the end of the day, when there's that routine, then you can plan prevention with that routine. And that's just the truth. Okay. So, but before you ask your next, I would say that in terms of the vaccine though, right, while I can't give you a particular figure, there is a program that the National Primary healthcare agency is pushing out. They've actually started sometime last year to make the the HPV vaccine available as part of our routine vaccinations. Like, every under 1-year-old child, yes, is able to go and get vaccines for free, all right, at every primary healthcare center or even tertiary hospitals like UPTH. So that is what we call our routine vaccination schedule. The plan now is to try and impute the HPV vaccine as part of that routine. So they've started in some other states, about 15 states in the country, as pilot states, and the hope is that at some point this year that vaccine will become a routine in Rivers State and in the other states.
Okay, I get you. 08090306416 is the WhatsApp number, and the call number is 08179230923. Swaka Christian on Facebook says, thanks for the information. Mohammed Bula Wagi says, good afternoon to you and the guest. Thank you so much. Ndubueze Wagiri says, beautiful people, good afternoon. I'm watching from Aba. I love Nigerian for thank you so much. Now this one is a question. Sorry, what I want to say is a bit different. My wife is pregnant. She went to scan yesterday. The doctor said everything is okay, just that the fetal pole is not visible. Yet I don't know what that means. Is something we should be worried about? Is it something we should be worried about? She's 7 weeks. Dr. Ruth, do you think you can handle this question?
Yeah.
He wants to know what the fetal pole.
7 weeks is a bit early in any pregnancy to conclude on certain things. That's why the doctor probably said it's nothing to worry about. Maybe just wait and observe that child. And she would have a repeat scan sometime soon, and then we can decipher.
He said does not know what fetal pole means.
Fetal pole has to do with the orientation of the child. Pole, not pole, south pole. Yeah. So, like I said, at 7 weeks, how big is the baby anyway? That's why I said just.
I know. Whenever there's a doctor in the studio,
7 weeks is actually, in fact, in the world of ONG, obstetrics and gynecology, a woman is pregnant after her second missed period. That would keep weeks. So it's from 8 weeks we are concerned about a pregnancy.
I heard HPV vaccination is for girls 12 and below. Do we have vaccination for older females? Otis from Port Harcourt. Did Otis miss the part where you said maybe you should just latecomers?
So vaccines are available. Okay, they have been available for some years now in this part of the world. However, they come at a cost, you should know, for any age right now. Okay, they come at a cost. So if you want to go to any health facility and ask them for HPV vaccine, they come at a cost generally. Now, up until about the fourth quarter of last year, that's when the National Primary Healthcare Agency rolled out a program to make sure that these HPV vaccines will be available for free. Okay, and that's for girls within the ages of 9 to 14. I didn't add that earlier. Okay, so that program that the Primary Healthcare Agency is rolling out is for girls between the ages of 9 to 14, which means that if you don't fall in that gap and you still feel you need the vaccine, so just know that they are available, but they will come at a cost, and that cost will be determined by wherever you're getting it.
Okay, so we have roughly not even up to 5 minutes. 3 more minutes. The phone lines have been acting up. Little wonder we've not been able to take some calls. Professor Banner says thanks for this enlightening show. I think Dr. Ruth has done her best to break everything down to our understanding, and if we don't have as much questions as we usually have, it's because maybe a lot of us understand. So thank you so much, Dr. Ruth Lawrence, public health physician. However, I try to see if I can squeeze in even one call. Nigeria Info, and we lost that call. Nigeria Info, good at, and we lost that one as well. All right, so final words from you, Dr. Ruth, as we round off.
All right, thank you so much for having me once again, and I'll just leave on the final note that prevention is 100% better than cure, and that also applies in this case. Don't wait till you look out for the signs of cervical cancer, the florid signs, because something is probably going on already. All right, so if you can undertake the vaccination, if you qualify, or the screening, those are things we advocate in preventing cervical cancer.
All right, thank you so much. Nigerian Info, good afternoon. Nigerian for good afternoon to you. Hello, good afternoon. Nigerian for good afternoon.
Yeah, good afternoon.
Good afternoon and welcome. Go ahead.
Sorry, my lady, the lady that is with me, is having some issues with heavy flow.
Heavy flow.
And whenever I'm making love, she's always having pains in her womb. So I don't really know what that means. When her monthly flow comes, like if it's someone that is committing abortion, the flow is so much.
Okay.
So me, I don't really know what it really means.
Oh, great.
Yeah, sure. Go ahead.
All right. So thank you so much for calling in. A heavy flow for any woman in its answer, because there are some women that just have a naturally heavy flow, yes, and even have menstrual pains when they are on their period. So if she's having that, and maybe it's persistent, and then that pain is extending to other aspects of her body, like I think I heard him say when they're making love, they have that pain and all, then it's something that you probably want to discuss with your health practitioner. It might not be cervical cancer, depending on all the other factors, but of course, once you sit before a doctor, they will ask certain questions and find out what adds up to see what next. Probably send her for some scans and make some appropriate diagnosis, which may not be cervical cancer. So you don't want to, I'm not trying to tag everything now as cervical cancer. Yeah.
All right. I would love to have you again right here.
I would love to be back
some other time. Yeah. But as every other conversation on Nigerian, for this one has to come to an end. Thank you so much, Dr. Ruth, once again. And thank you for being a part of the sunny side today. I'm about to leave, but Rivers Today comes up at 3 o'clock. Kaladako Rubatiba will be here 3 o'clock for Hat Facts. Follow us on X at Nigeria Info PH. Follow us on Facebook, Nigeria Info 92.3 PH. Follow our Instagram handle at Nigeria Info FM _PH. Now follow me on Instagram and on X at _Denise_Dennis. Follow my Facebook page, Denise Dennis, and follow my Facebook account, Denise Dennis Wallo. I'll be back here tomorrow on the sunny side for Friday's edition, and I look forward to that because we get to scream, thank God it's Friday! We're going to let down our hair and have as much fun as possible. So help us God. Adios.